afternoon, and thank you for joining us for today's COVID-19 media briefing. This is a Q&A about vaccine. It's being aired live on YouTube. And joining us today are DHS Secretary Designee Andrea Palm and Dr. Stephanie Schauer, Immunization Program Manager in the Division of Public Health. And we will begin this briefing with remarks from Secretary Designee Palm.
Thanks, Elizabeth. Good afternoon, everybody, and thanks for joining us. Before we take your vaccine questions, I want to walk through the events that we have gone through here the last week. It's been quite a rapid clip here. So last Thursday, the FDA Vaccine and Related Biological Products Advisory Committee recommended approval of the Pfizer vaccine. The FDA reviewed that recommendation, Pfizer's application, and the data they had, and approved the emergency use authorization on Friday. Over the weekend, the Advisory Committee on Immunization Practices issued guidelines for the administration of the vaccine, and the CDC accepted and published those recommendations in the Morbidity and Mortality Weekly Report. On Monday, around 10,000 doses of the Pfizer vaccine arrived at 2 of our hubs here in Wisconsin. Yesterday, 4 additional hubs received around 22,000 doses, and today, our last 2 hubs expect to receive the remaining amount of our allocation, which is about 18,000 doses. Our 8 regional hubs are outfitted with the ultra-cold storage equipment the Pfizer vaccine requires, and will serve as central locations for further distribution to other healthcare providers. With the small amount of vaccine arriving in Wisconsin this week, we are starting with a small number of providers to help ensure safe and efficient distribution. As more providers complete the vaccinator training and enrollment process, we will continue to expand distribution. This week's total shipment, as you know, is 49,725 doses of Pfizer vaccine, and there will be further allocations in the coming weeks, which will allow us to continue to focus on the healthcare workers in Phase 1A of our vaccine program. Tomorrow, the Vaccine and Related Biological Products Advisory Committee will review the data on the Moderna vaccine and make a recommendation to the FDA. Pending their approval, we anticipate an initial allocation of about 100,000 doses of Moderna vaccine. In addition, earlier this week, we activated Wisconsin's Pharmacy Distribution Program, which is a partnership between the CDC and national pharmacy chains to provide on-site vaccination at our skilled nursing facilities. While the arrival of vaccine is a critical and exciting milestone, and so very important to our ability to end the COVID-19 pandemic, it is early, and our vaccine distribution process will continue to evolve as the amount of vaccine coming into the state changes and as we learn lessons as we have throughout this pandemic. We remain committed to keeping you as informed as possible through briefings like this one and updates to our COVID-19 webpage, which you can find by visiting dhs.wisconsin.gov/COVID-19 and by clicking on the vaccine tab. And finally, please remember that it will be months before the vaccine is widely available. So please continue to stay home as much as possible, wash your hands, wear a mask, and physically distance. If you have symptoms of COVID-19 or if you have been exposed, please get tested, isolate, and quarantine. We've added another tool to our toolbox thanks to this vaccine, but we need to remain vigilant and continue using these other tools just a little while longer. Thank you.
Thank you. And we will now take your questions. A reminder, to maintain audio quality, please remain muted until it's time to ask your question. If you are on the phone and you are able to do so, please use *6 to mute and unmute. And we begin with Danny Maxwell, WKOW.
Hi there, this is Emily filling in for Danny. You keep mentioning these additional hubs will receive the remaining doses of the Pfizer vaccine. What are these other hubs? Can you be specific? Are they long-term care facilities? What does other healthcare providers mean? Can you give an example?
Yeah, so our hubs are locations that are geographically diverse around the state. We've got at least one in every region of the state, and they are partners who have volunteered because they have this ultra cold storage to be a location which houses and stores vaccine for further distribution to spoke and other healthcare provider locations throughout the state. So really, the hubs are a part of the distribution system for the Pfizer vaccine.
But can you give an example of what?
Thank you so much for that. And, all right, we just really have time for one question per reporter, and we will try to get back to you, Emily, with additional specifics. But we need to move on right now to Scott Bauer of the Associated Press. Scott Bauer.
Thanks for doing this call. Secretary Palm, tomorrow the state Supreme Court is hearing arguments in the challenge to the rejection of the capacity limits order that you issued. Can you talk about how important it is for public health from your perspective for you to be able to issue future orders like that if needed?
Thanks, Scott. I think, you know, broadly speaking, the authorities that state public health and our local public health partners have and have had for a very long time are designed to allow us collectively to help protect the health of the people of the state, and right, as similar to states all around the country, to do the same for their populaces. And those levers, you know, are designed for things like communicable diseases and other places where the science and the local public health folks need to take action. Again, that is necessary to protect local public health. So I think whether it's in the context of COVID-19 or a measles outbreak or other things that we may face in the future, these tools are really critical to our work, and you can see that in the mitigation strategies and the way that they have come to be and get rolled back in a variety of places around the state where those authorities have been utilized, and in other places where they have not. And they really have shown themselves to be effective in reducing the spread of COVID-19, and will continue to remain to be important until we have enough vaccine in the arms of Wisconsinites to really to be that final tool that helps us end this pandemic.
Thank you for that. Let's go now to Sean Kirkby of Wisconsin Health News.
Hi, thanks for holding this. I was wondering, do you have any numbers on how much Pfizer BioNTech vaccines you're expecting to get next week? Thank you.
Yeah, thanks, Sean. I would say this is a place where we as a state, and I'm sure many other states would agree, could use considerably more visibility on the distribution from the federal government. We do not yet know what our allocation of Pfizer vaccine will be for the next round. We assume for next week. We certainly hope to receive that information soon, but obviously that's critical to our ability to plan, to work with our partners to allocate that, to push it out and make sure that it is safely and efficiently used in our 1A healthcare, frontline healthcare worker populations. I don't know, Dr. Sheriff, if you want to say any more about that.
Yeah, no, I think that's right. It is something that we have received initial and really look forward to a time where we may be able to receive that on a more regular cadence and really can help inform our planning going forward, but we're just not at that period yet.
Thank you both for that. Let's go to the next question for Stephanie Hoff, WIS Politics. Stephanie.
Good afternoon, and thanks for taking my call today. I'm wondering how many of the current allocation of Pfizer vaccines have been administered. Thank you.
Thanks, Stephanie. And I would say more broadly, and I sort of mentioned it in my opening remarks, like other information that we have provided throughout this pandemic, whether lab capacity, testing, cases, deaths, outbreaks, et cetera, we absolutely intend to add and expand and include information about vaccinations moving forward. To date, what I can tell you, what I know is that we have 192 vaccines in arms that have been reported into the Wisconsin Immunization Registry. And again, we will, at least on a weekly basis to start, update those numbers, and we'll expand that work as more vaccine comes into the state, and make sure that our website has information that is timely and updated for you all in a variety of metrics within the vaccine distribution.
Thank you, Secretary Designee. The next question to Sophie Carson, USA Today Network. Sophie Carson.
Hi there. My question is regard to sort of consent for nursing home vaccinations. Sort of what is required in terms of consent for residents who may be sort of cognitively impaired, and what's the state planning to issue? What kind of guidelines regarding obtaining full and informed consent from those residents?
Thanks for that. Dr. Schauer, could I ask you to take that?
Sure. So the residents of most long-term care facilities and skilled nursing will be done through the pharmacy program, which is a federal program that is pairing up CVS and Walgreens with facilities to go ahead and provide the vaccination. And they will be involved in obtaining the consent. And I think we'll follow similar lines for consent for other medications as needed if someone is impaired or unable to make those decisions. But really for those individuals, that is being guided by a federal process in that federal program.
Thank you. The next question, Mary Jo Ola, TMJ4. Mary Jo.
Hi, good afternoon. Just hoping to get a little more detail on the plans for Moderna's vaccine, which is expected to be authorized regarding the 100,000 doses Wisconsin's expecting. Since the distribution is going to be different than Pfizer's, can you just go into a little more detail about what that distribution looks like and where those doses will be going? Thank you.
Sure. So what I can tell you is we certainly want to make sure we know exactly how many doses of Moderna are coming should the vaccine be approved. So so we will not make final decisions about distribution until we know our final number. But second, to your point, because it doesn't require the ultra cold storage, the distribution for Moderna can go directly to the vaccinators. It does not need to go through the hubs and out to the spokes. And so as additional healthcare providers are able to register as vaccinators, we will have a broader array of healthcare providers on the ground who will be able to receive the Moderna vaccine, again, just without needing to go through the hubs and out to the spokes. It can go directly, for lack of a better word, to the spokes. Stephanie, I don't know if you want to dig in with any more detail or if that works.
Yeah, no, and I think, you know, the allocation size of the Moderna vaccine really allows for us to get doses to those smaller clinics, more rural clinics, in a way that reduces the number of logistics. So we look forward to, should that become available and approved, that gives us many more options with fewer logistics going forward. And I will say, as the The one, as Secretary Designee Palm said, is this vaccine does not go through hubs and spokes, but rather goes straight from the manufacturer to the end user or the end vaccinator.
Thank you for that. Let's give the next question to David Welberg at the Wisconsin State Journal.
Yes, thank you. Given that we're almost 3 weeks after Thanksgiving now and new cases have remained lower the last couple of weeks, as well as hospitalization, do you feel confident in saying that we haven't seen any post-Thanksgiving surge? And what's your message for the upcoming holidays?
Thanks, David. You are exactly right. We are past that 14-day incubation period that you would have seen from a Thanksgiving Day gathering, and even the tail of if you stayed for the weekend or if you had people in for the weekend. I think we do feel good about the fact that we continue to see a plateau, a decline in hospitalizations. I think other metrics like COVID-like illness that you're seeing in emergency departments is also something that we've been looking at because we've been concerned about a decrease in the number of tests being performed, and that may be some of what is therefore resulting in lower daily case numbers, and we didn't want fewer tests to be masking positive cases in a way that was going to surprise us in hospitalization rates. But emergency department visits for COVID-like illness would be a way that you could compensate for that, and we have not seen signs in those numbers that suggest things that we wouldn't want to see. So I think we feel pretty good about where our numbers are post Thanksgiving, recognizing that we are still, as a general proposition, way too high. Our hospitals are still strained. They are still having significant staffing shortages. We are still seeing too many deaths. And so while this is certainly hopeful news, we have to continue to drive down our numbers. We have to continue to be really vigilant about the mask wearing, about the staying at home, about the good hand hygiene. And it certainly means we have to keep our foot on the gas, and we have to double down as it relates to the upcoming holidays, and do at least as well as we did for Thanksgiving over these next set of holidays, because we need to protect our frontline healthcare workers from cases that are above what their capacity to serve people would be. So I think continued vigilance is the message, continuing to double down, but certainly grateful for the small amount of relief that Wisconsin has seen and been able to give to their hospitals coming out of Thanksgiving.
Thank you. Let's go to Madeline Anderson, Fox 6 in Milwaukee.
Hi, my question is, while we wait for healthcare workers and residents of long-term care facilities to be vaccinated over the next couple of months, what advice would you give to the average person, someone who maybe is healthy and doesn't have any conditions that put them at risk, or someone who maybe is over 65 or has, asthma or something like that? Just kind of anyone who's not in the first two priority groups, or this first priority group, what advice would you give them? Should they contact their doctors? Should they just wait to hear from you guys from the daily media briefings?
Yeah, that's a great question. And we're all hungry to understand more about how this is all going to go and how long it's going to take, and when it's going to be available for me and for my family. And those are all super legitimate questions. And and you're right, our daily and regular cadence of media briefings are going to be important ways that we help spread information as we receive it about how it's going, how it will go in the future, and what folks can expect next. I think other ways that we are looking at in terms of trying to be creative about communication are our partnerships with healthcare, such that you know, if you have an app on your phone where you get notifications about the annual flu shot through MyChart or through some other mechanism with your healthcare provider, how do we utilize those kind of vehicles to help continue to provide information to people, either when it's time for them, or other information that might be helpful as we continue through this process. So we're looking for multiple avenues to make sure that people have information. But I do think it's also important for folks to know that the windows, for lack of a better word, of the priority populations don't open and close. We want to make sure, for example, in this 1A category, that all of our frontline healthcare workers get vaccinated first. It doesn't necessarily mean that once the vast majority of them are vaccinated, that we won't start in the next phase. And if folks in 1A didn't get it, that they can't join the 1B group and get it afterwards. So the windows are not going to close on people. We certainly want to make sure that high priority populations know about it, get it as soon as they are eligible. But you aren't going to lose your opportunity if you don't receive it during the window that is particularly called out for a population group that you are a part of. But Stephanie, Dr. Schauer, I would certainly welcome any other thoughts you might want to add here.
Yeah, sure. And, you know, I think as we move further into phases 2 and 3, where we move into where the general population is eligible, the opportunities for where people can get vaccinated will look similarly to influenza. So you may get a reminder from your healthcare provider, but pharmacies are going to be important. We'll also see community sites perhaps popping up. And so I think there's a number of different vaccinators. We'll see that expand as we get into that phases 2 and 3. And the media presence will be important to notify folks. Certainly for individuals, if we move to those 65 and older, that's easier for healthcare providers to call those individuals in, or for pharmacies. And so I think there's a number of different modalities that we look to, and it becomes more similar to seasonal flu the further that we get into those different phases.
Thank you for that. Let's give the next question to Rose Schmidt, CBS 58 in Milwaukee.
Hi, thanks for taking my question. I guess my question is kind of a follow-up to what was just asked. I guess, when do you anticipate everyone in the phase 1A done being vaccinated? So I guess, in other words, when do you anticipate moving into phase 1B? And what would you say to people who are in phase 1A but aren't, healthcare workers? So essentially, I guess, what's the timeline for long-term care facilities being done vaccinated, and then the EMS workers who fit into that category, and the home care workers who fit into phase 1A as well?
Yeah, I'll start, and then would welcome you rounding it out, Dr. Schauer. I think fundamentally, how long it takes for us to get through 1A is contingent upon our weekly allocation of vaccine. And as we have discussed, we don't get very good visibility on that. We have short notice about what's coming next, and how much that is on a weekly basis is different we anticipate it'll be different every week. And so some of this is very much dependent on what we get on a weekly basis in terms of vaccine here in the state of Wisconsin. We know that there are about 400,000 healthcare workers. That does include EMS, home care, the other groups of healthcare workers that you mentioned. And then on top of that, it includes nursing home staff as well. And on top of that, about 400,000 is about 57,000 folks who live in skilled nursing facilities. So how fast we get through those 450, 460,000-ish people is, it really matters how much we get on a weekly basis here into the state of Wisconsin to push out to those populations.
Yeah, no, and I agree. I think there's things within our control and things that are not within our control. The one thing I will add with the skilled nursing facilities is we did announce that we were kicking that off. We needed to give CDC a 2-week notice, and we anticipate that program, the vaccination of the skilled nursing facilities, both patients and residents, or excuse me, patients and staff, will start at the end of December. And so we know that they will go ahead and work on those, and we'll go from there. So we do have a timing on that piece of the puzzle.
Thank you. Now to Jake Ekdahl, Waukesha Freeman. Jake.
Hello. I'm just wondering, knowing that staffing has been a major challenge in schools this year due to COVID, I'm wondering whether vaccinating teachers could help keep schools open for face-to-face learning, and whether teachers as a group are in future phases or plan to be in future phases for groups like 1B or later.
So what we understand about what the Federal Advisory Committee is looking at after this phase 1A is a phase of what they're talking about as essential workers, and the considerations for how to think about within that category of essential workers is guidance we are anxiously awaiting from them, as well as the group of medical experts that we have brought together to further refine and Wisconsinize the recommendations we get from the Federal Advisory Committee. But I think things like, as you suggest, proximity to the general public, proximity to populations who can't be immunized, like those under 16, which would capture your teachers. So those advisory committees are considering all sorts of factors to help give us guidance about how you think about essential workers, how you think about prioritizing within that group of essential workers, and we will await that guidance. And obviously, considering how many healthcare workers and skilled nursing and assisted living folks in phase 1A, they've got a little bit of time to consider it, because it'll take a number of months for us to get through all of 1A. But Stephanie, if you want to say any more about essential workers, I would certainly welcome that.
Yeah, no, I think, the State Disaster Medical Advisory Committee is really wrestling with this, and, their meetings are open and available to the public to listen in on, and the guidance that they put forth will go out for public comment. So really just making sure that people, if they have a voice that they'd like to make heard, that they join those meetings, that they weigh in on that public comment period, because the essential worker category is, there's many groups that I think you could argue have very good cases of being included, and it's important that we hear all of those voices and that group has that information to wrestle with.
And we do have a link to that committee on our website. Thank you both for that. We'll go now to Sierra Trojan, WLUK, Green Bay.
Hi, thanks for doing this call today. When the time comes for the general population to get the vaccine, I'm wondering if you're still considering drive-through vaccine locations, and if so, where are you at in the planning process for that? Do you know where those might pop up or how that would work? Thank you.
Yeah, so I think we're absolutely considering a number of options. I think one thing that's important, at least for us in our thinking and learning and planning, is what we have learned from the testing program that we have set up as part of this response. And there are many things about our partnership with the National Guard and with healthcare providers and others that could teach us good and important things as we think about a vaccination program for the general public. And one of those that I think is really important for folks to remember and to understand is while our community testing sites and our National Guard partnership have been very visible and are now 71 locations around the state of Wisconsin, our healthcare partners have done over half of the COVID testing that has happened throughout this pandemic, and we expect and anticipate that that there will be parallels, that similarly with the vaccine, many people will receive vaccine through their healthcare provider. Also, right, we've seen pharmacies engaged in testing. We anticipate they will be an important partner in vaccine beyond the partnership program that is vaccinating skilled nursing facilities. But also that there will be a needed component that is community vaccination. And so we are absolutely thinking and planning for all of those scenarios, and have been doing work to prepare to be able to make sure we have the kind of staff and assets that would be required to do community vaccination clinics. And we'll certainly be ready when the time comes, although, right, we have a ways to go before the vaccine is widely available enough for the general public. But all of those things are on the table, and we very much are looking forward to the time where we've got enough vaccine here in the state of Wisconsin and have gotten to a place where we're vaccinating the general public. I don't know, Dr. Shaw, if you have any more you want to add to that.
Yeah, I would just add that, this will also be data driven as the vaccination campaign unfolds. We will be looking for places and folks where they have received it and where they have not. And that information should really guide where our efforts go to make sure that we're closing those gaps and addressing those. So I think more to come in evaluating as we move forward to be sure that no one is left behind.
Good, thank you. Now to Nick Bohr, WISN Milwaukee.
Good afternoon. I had a question about people that are actually getting the vaccine and the card that they're getting. It's kind of sparked conversation about proof of vaccine issues and whether that should be used as any sort of admission for travel or work or to go to a concert or anything along those lines in the future as this is more widespread. Do you see that being anything where government has a role in giving people proof of vaccination, as some countries have talked about, some other states? And how will that be tracked with the Wisconsin Vaccination Registry? Could you talk about that?
Yeah, I'll ask Dr. Schauer to weigh in here. I think broadly speaking, and to your point, I think you were acknowledging this, there needs to be a lot of vaccines in arms before it as a tool to end this pandemic is able to have an impact. And herd immunity, or the threshold by which we've really gotten enough vaccines in arms is a place in this vaccine program where we are at the place where vaccine is widely available and we are vaccinating the general public. So I think this idea that 1 or 2 or 10 or 100,000 vaccines in arms is a place where we will be able to let down our guard and stop doing the things that we need to do with the other tools that we have. I just want to set expectations that it will be considerably longer than that before this idea of returning to normal is something we're really able to embrace. We're going to have to continue to do this other work and use these other tools. But I don't know, Dr. Schauer, if you want to say anything specifically about the cards that I know the feds are distributing.
Yeah, the card is a requirement for vaccination, but I think it's important to also remind folks that that information will be in the Wisconsin Immunization Registry so that their healthcare provider has that information and that they can go ahead and actually access it themselves through the registry. And it also includes important information about which dose they need and when do they need that second dose. As a reminder, you have to have a match with whatever type you received the first dose. You should match it with the second dose to really get that maximum efficacy that they are talking about. And so the Wisconsin Immunization Registry is one way that folks can track it themselves, and their healthcare providers can be sure that they're getting the appropriate medical care and get doses when they need it. So.
Thank you. Now to Elise Romas, WMTV in Madison. And a reminder, *6 will mute and unmute your phone. Elise Romas.
Hi there. Just a question about the Moderna vaccine and its approval. I have been reading that the Moderna vaccine actually slows the spread or prevents the spread of COVID-19. I'm wondering, with that in mind, what does that look like for when that will likely be approved, and the speed and the rate of how we can get people vaccinated and really, I guess, beef up that immunity herd?
So I'll say a couple of things, and then, Dr. Schauer, I certainly always welcome your comments as well. I think as it relates to the approval, right, the FDA's advisory committee is meeting tomorrow, and will take a look at the data and take public testimony and provide a recommendation to FDA, which they will consider as they look at the application and all the data that Moderna themselves have submitted as it relates to the efficacy and the safety and the profile of that vaccine. And then it will follow like the Pfizer vaccine did. Should it be approved, it will go to the Advisory Committee on Immunization Practices, and they will provide some guidance about its administration, some guidance to vaccinators. Should there be side effects people should know about, if there are populations that should or should not receive the vaccine, the kinds of things that folks who are actually putting those shots in arms need to know to safely administer it. And so I expect, to your question, that we will get information post-approval that could help guide the questions you're asking around reducing the spread. But I think more broadly, we're going to need a lot more doses than the 100,000 we're getting from Moderna, potentially out of the gate here, to get to a place where we are thinking about reducing the vigilance with which we're using the other tools in our toolbox, the masking, the social distancing, the staying home, et cetera. And as if it's approved and as it rolls out to us, our ability to put those shots in arms, again, is dependent on how much our allocation is on a weekly basis. How much can Moderna manufacture, and then how much are the feds turning around to the states? So a lot of these questions are questions we anxiously await answers for as well, and obviously we'll share that out as we get it. But there still are a lot of unknowns, particularly since this particular vaccine is still pending approval. But Dr. Schauer, if you have anything you want to say, I'd welcome it.
Yeah, no, the process that has been used, where we have the FDA reviewing, they've received the data, it's line by line data. They are actually having their statisticians and scientists comb through the data and look at it and do their own analyses and review it, and then passing it, onto the advisory committee on immunization practices. These are groups of individuals and that we rely on for immunizations in general to really evaluate what the vaccine should be used for, who it should be given to, et cetera. And so we really rely on that sort of honed, well-oiled machine, and that process that is used that is transparent and full of rigor to go ahead and provide us the type of information that we look for.
Thank you. Next question to Natalie Sapola, WAOW, Wausau.
Hi guys, I just wanted to follow up on something that you guys briefly touched on earlier. Just wondering, what exactly do you think could potentially be the cause of this sort of downturn in cases that we're seeing, especially as we're right now in between, the two major holidays of the year when, some people have chosen to gather in large groups?
Yeah, so Natalie, I think it's, it's hard to say precisely, and I am sure that it is not a single thing. But I do think that people are, particularly the people of Wisconsin, are genuinely concerned when they see on the news and in the newspaper their local hospitals as strained as we were seeing in that run up to November, or excuse me, that run up to Thanksgiving in October and through mid-November. And I do think that folks really do want to do the right thing as it relates to reducing the spread of COVID-19. And I'm grateful for all of the work that people are doing to help take some of the pressure off of our frontline healthcare workers and help them be able to treat folks who need hospitalization to the best of their ability. And so it proves that we do control our own destiny as it relates to the severity of this outbreak and eventually the number of people who die from it. But it also proves that our vigilance needs to continue and that we need to continue to do it more actively so that we can continue to reduce our daily case numbers, because they are certainly still too high, and we are certainly continuing to see more deaths than are necessary. And so I think people should feel good about the work that we are doing together. I think we should all feel particularly good that the vaccine is here and that we're starting to get it in arms, and use that as motivation to continue to do what we need to do to get to the light at the end of the tunnel here, all the while continuing to reduce our cases and the number of deaths.
All right, the next question now to John Neisser, NBC 26 in Green Bay. John.
Yes, thank you for the opportunity. This is kind of a tough one to wrap my head around, but we've been hearing all along about how, along with frontline healthcare workers, that individuals in long-term care facilities are also a high priority. Can someone kind of explain why the decision or where the decision was made that the Pfizer vaccine would not be involved in long-term care and they're waiting on the Moderna?
Yeah, so I think, and Stephanie can dig into the details of the program requirements. But I think there are a couple of factors. One, first, I should say we have turned on our partnership program and designated the Moderna vaccine for skilled nursing facilities. As we've talked about, the feds require a 2 weeks notice, which we did give them on Monday, and we expect to start seeing vaccines in arms at skilled nursing facilities the week of December 28th. One of the requirements for this program is that we have enough vaccine in our allocation to set aside enough for the populations that in skilled nursing who will receive it. And so the Moderna, our allocation of Moderna, which we expect to be about 100,000, provided us with a large enough allocation that we could set aside what we needed to for our skilled nursing population. But again, Dr. Schauer, if you want to dig into any of the details of the program that help better explain this, I'd welcome it.
Yeah, no, I think you're right that it's, the allocation piece and wanting to certainly go ahead and ensure that we get that program kicked off sooner rather than later was a driving factor, and the allocation piece is significant. And, predicated on that it would be an approved vaccine and available and recommended for that particular age group, we felt that that was a great option to go with. Didn't really difference it from the Pfizer vaccine. Both have same types of age indications anticipated, et cetera.
Okay, thank you. Let's move on now to Griselda Perez, Spectrum News.
Hi, thanks for taking my call. I'm wondering, a little bit piggybacking off the last question, with the allocations of the Moderna vaccine, do you anticipate mostly, or maybe if not all, going towards more of the rural areas of our state?
So we will continue as vaccine becomes available to expand the providers who are receiving it. There is a registration process for vaccinators by which we have some federal paperwork that is required. There are some trainings that are required. And so our vaccinators continue to go through and finalize that work and expand the number of available places and vaccinating entities around the state. So as more vaccine comes in, we certainly anticipate being able to distribute that to more and more vaccinators around the state. And as you note, the reduced storage, cold storage requirements, or the different storage requirements between Pfizer and Moderna certainly opens up the places that can receive the Moderna vaccine. And again, we really are anxiously awaiting adding that tool to our toolbox.
Okay, let's go to Katrina Lim, WQOW, Eau Claire.
Hi there, thanks for taking my call. I just wanted to ask, is the vaccine safe for pregnant women to take? And would the state consider doing free COVID vaccine clinics, like how there's been like free flu clinics?
Yeah, I'll take the second one, and then Stephanie, I will ask you to take the pregnant women question. We intend for this vaccine to be as widely available as possible, and that means reducing all barriers to getting it. And so the federal government has procured the vaccine and are supplying it to states for free. The fee that is associated with it is actually the fee to put it in the arm, the administration fee, and we insurers have been are required to provide that to folks, and we will, as you suggest, do things like community vaccination clinics and others that are no cost to folks who don't have insurance that will cover that administration fee. So we intend to reduce and eliminate all barriers to vaccination, because we need to make sure that every person in the state of Wisconsin who wants one can get it without any out-of-pocket cost to them. Obviously, Dr. Schauer, if you want to say more about that, you're welcome to, but if you could take the pregnancy question, I would appreciate it.
Sure. So pregnant women are at increased risk of severe disease, including, ICU admission, being put on or undergoing mechanical ventilation, and even death. But there is no data currently to establish the safety, and that was noted by ACIP, but studies are ongoing and more are planned. But if a woman is pregnant, is part of a recommended group to be vaccinated, such as a healthcare personnel, she may choose, and that decision really should be made in consultation with her healthcare provider to make an informed decision. And some of the things that they need to consider, or she would need to consider, is, what is the level of community transmission? What's going on around where she lives and works? What's her personal risk of contracting the disease? What's the risk of the disease to her and her developing fetus? And then thinking about the efficacy of a vaccine, the known side effects, and that lack of data, and all that pulled together will help her to make a decision. And so they really left it as a decision to be made by the woman if she is in one of those recommended groups. And we do expect more information to be forthcoming on pregnant women, as well as other groups such as individuals who are immunocompromised and children. While that wasn't in the initial recommendations, those are groups that we will continue to see, I think, more data come out, and we may see some changes.
Good, thank you so much. Our final question now to News 3 in Madison. News 3. A reminder, *6 will unmute your phone. News 3. All right, well, with that, we will conclude today's briefing. We want to thank Secretary-Designee Andrea Palm, Dr. Stephanie Schauer for participating, as well as all of you. Please continue to monitor the DHS COVID web pages for data and guidance. You can find additional information on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.